Good, ladies and gentlemen. The governor of the great county of Kisumu would have really wished to be here, but he has had other engagements. In fact, we were supposed to have been here yesterday, but we are here now. Officially welcome to Kisumu County and officially open this very important annual. So I will read his speech. That will be it. All delegates and stakeholders, invited guests, ladies and gentlemen, I take this opportunity to welcome you to the Lakeside City and hope that you find time to explore the local scene and the great sunsets for which we are known for. I'm so honored to be here today to talk to you during the annual conference whose theme is mental health for sustainable development. Ladies and gentlemen, health is a state of complete physical, mental, and social well-being, and not merely absence of disease. However, mental health remains a neglected part of our effort to improve health. As we all know, mental health is a leading contributor to the global burden of disease. 20% of the years live and disability worldwide. Mental health illnesses also contribute to the vicious cycle of poverty and poor health, outcomes, premature death, human rights violation, national economic loss. Those affected also affect others, especially women who are forced to be caregivers, thereby diminishing the productivity further contributing. 75% to 95% of the people with mental conditions are unable to access mental health care in low and middle income countries. This underserved population also experiences a constellation of adversity, making them at a higher risk of mental issues that have higher demand for such services. Looking at funding opportunities, mental disorders receive the least amount of philanthropic funding compared to other health conditions in low income and middle income countries. This, coupled with lack of investment in mental health, contributes to the treatment gap. There is therefore an urgent need to continue investing in mental health and increase access to services in the nation. Because mental health operates under a higher umbrella of health sector, allow me to say that I was very pleased with the findings of the Kenyan Demographic Health Survey released in January 2020. This finding brought light significant improvement in health indicators in this country, and particularly for our case in Kisumu, compared to situations in 2014. These results are a testament that our approach to healthcare is bearing. One major improvement was the access to healthcare, where skilled birth attendants increased from 69% to 94%. I likely attribute this to the bold decision we took in investing heavily in community health and in primary health. These investments will help us leverage on the structures to deliver health services for other diseases, including mental health. It is my hope that the Department of Health, mental health is integrated in primary and community health access. Ladies and gentlemen, what is required today is increased increased investment on all fronts for mental health. Mental health awareness, increased understanding for certain people to increase access to quality mental health care and effective treatment, and finally, for research to identify sustainable treatment. As a country, we have significantly increased our total health workforce from 1,407 in 2017 to 2,167. We have also recruited 2,998 community health workers and are giving them stipends. Of course, we are proud to report that we have attracted and retained 3 consultant psychiatrists in Kisumu County, 2 psychiatric clinical officers, 6 psychiatric nurses, and 1 social worker county payroll. Identifying the role that qualified human resource for health play in advancing these services, we intend to expand these numbers and anchor them on the 35 primary care mini hub located in each ward. I am excited, ladies and gentlemen, by the strides that the county is making in the expansion of mental health services in line with national policy framework. The Kisumu Mental Health Action Plan 2023-2027 is almost complete, and the launch plan for October 10th during the commemoration of the World Mental Health Day. In this plan, we envision ourselves as a county where mental health is valued, promoted, mental health conditions are prevented, and persons affected with mental conditions are treated and integrated without stigma and discrimination. And our goal is to attain the highest standard of mental health among all populations. Ladies and gentlemen, I'm also happy to note that we have established Kisumu Mental Health Council that will oversee the adaptation and implementation of mental health policies. In addition, we have begun the formation of a functional, intersectoral, collaborative, technical working coordination committees at all. In the coming days, recognizing the danger that death by suicide poses, we will be seeking to adopt and operationalize the Kenya National Suicide Prevention Strategy, create awareness on suicide, alcohol, and substance abuse disorder, while recognizing local study population. Ladies and gentlemen, we will also be prioritizing workplace mental health by providing an avenue for self-screening by healthcare workers and dedicated psychological counseling. We are working to ensure early identification of persons while mental health. Ladies and gentlemen, I am proud of the work that goes on into the mental health space by various professionals who are at the forefront of advocacy, service delivery, policy, and planning. The Kenya Psychiatric Association has indeed positioned itself strategically as a key pillar and a player in space, and the county is proud associated. I look forward to the discussions, presentations, and networking that will happen in this conference, and welcome you to the county once again. I wish you all very pleasure. Thank you. That is it. I have nothing to add. Thank you very much.